So, quick video about what not to do if you're having an acute or severe back pain. People are always asking me what to do if they have back pain, and I spend most of my time telling them not to do those things. Now, I do have a couple other videos floating around where I have a couple of exercises that you can try if you're having back pain, that kind of thing. But in general, you want to treat an acute or acute onset back pain issue as like a sprained ankle is sort of the best analogy, okay, the closest analogy. When you sprain your ankle, are you going to go and do a bunch of stretches and exercises on your ankle to make it feel better faster? No. But for some reason, when people hurt their back, they spend a lot of time on the internet looking for stretches and exercises and things to do for the back to make it feel better. And in general, those things just tend to aggravate the problem, or at the best case scenario, do nothing, right? So you really want to just rest a back injury, treat it like a sprained ankle, don't do a lot to it, okay? So there are a few home care techniques. There's 3 that I really like for home care that aren't going to aggravate your back typically. Number 1 is icing. So when you ice for 20 minutes at a time. You can ice as often as every 2 hours. Do not ice longer than 20 minutes or more often than every 2 hours. It is not better. For back pain, try to avoid heat. Okay, that typically it can make it worse, by the way. Second thing to do is topical pain creams. There's a million choices nowadays. BioFreeze is a big company that sells pain creams. There's CBD versions. There's all kinds of things like that. Everyone has a different opinion on this as far as what works best for them. Go try some pain creams. They're not going to make you better, but they're going to make you feel better temporarily, which is totally fine. And the last one is something called a TENS unit, T-E-N-S, TENS unit. This is something you can buy at Walgreens or Amazon. It's an electrical tool that you put pads on your back in the painful area. Again, it's not going to make you better, but it's going to make you feel better temporarily, and so there's nothing wrong with that. So to summarize, you really want to avoid doing a lot of things when you're having a back injury. You want to let it rest and treat it. If you have any questions about that, or if you're having trouble with your back pain, we have a whole suite of tools here. Treatments, spinal decompression, chiropractic, class 4 laser. I think these things are great for chronic and acute back pain. So give us a call if you just have any questions. All right, talk to you soon.